It's not absorbable. It's a permanent material. So the anchors are never going to be dissolved. And that was one of the reasons why we were interested in studying pain as an outcome, to ensure that there wasn't going to be an increase in pain with the device. And we certainly have seen that there is, we've not had any patients with intractable long-term pain. So in conclusion, I love to use AnchorSure, specifically using the anterior approach to hysteropexy, where the dissection is much smaller than when we approach the ligament through a posterior approach. Having a small profile instrument is beneficial in this circumstance. We find that there's a very low
the difficulty in retrieving the anchor. And I've never really found the anchor to be the problem. It's really about the amount of tissue that's involved and trapped or incorporated in some sort of, in strangulation or ischemic change, right? So what's beautiful about this device, if your anchor is someplace you don't want it to be, you just pull the suture away, the anchor just floats up into never, never land. There's no traction on that anchor. It has such a small footprint, it's not really going to do any damage in of itself by its sheer presence. So you don't have to go fish the anchor out. For 30 years, I've dug out a lot of people's sutures that were placed and caused retractable pain. I've never had to go after an anchor. Just haven't never had to dig an anchor out.
This slide shows the profile of the anchor when compared to Capio or Capio-like devices. It is important to know that it's not just the profile which is of importance, but it's the tactile minimal dissection needed to apply the anchor compared to visualization of the sacrospinous ligament needed for freehand suturing or placement of a Capio device. My clinical experience to date, I've performed over 1,000 repairs utilizing AnchorSure with over 3,000 anchor placements. We've had no intraoperative or immediate postoperative complications directly related to the anchor.
The needless sling has been a very good sling for me for appropriate patients who do not need a retropubic sling. It is a simple and easy sling to utilize and has shown excellent results.
Thanks. So in conclusion, this is a feasible procedure with high success rate in complex cases, and it's another option for our complex cases that we all have. And it's helpful with recurrent SUI, SUI with detrusor underactivity, SUI after sling removal because of voiding dysfunctions, and in cases of severe SUI.
The uniqueness of this sling, and what essentially brought me to kind of look into it a little bit more, was the capability of providing adjustability, which I think is the main focus of this particular sling. I have found that there's minimal pain and discomfort after implantation. What kind of data is there on Remix Sling? Well, surprisingly, looking over the last 20 years, there's over 50 publications and presentations on the use of Remix Sling. Pettit in 2010 presented at the ICS IUGA conference their 5-year follow-up. 68 patients, 97% dry rate. And their final comments were that this is an excellent procedure, an excellent salvage procedure for patients with ISD and stress incontinence.
So Andre Player asks, did any of the longer term studies for Remix talk about tightening that was remotely removed from surgery? Have you heard of anyone that needs to like do a tightening like, you know, a year or a couple years out?
Yeah, great question. So when I was in Barcelona with Dr. Arando, he actually adjusted a patient who was 12 years out from her Remix sling. And it was amazing to see the ease. I think it took about 15 minutes to do. He was able to find the little tensioning device pretty easily and attached the tensioning screwdriver device there, and the patient would follow up in the office the next day. So yes, I have seen that.
I think we've had a nice exposure to some of the products that Neomedic makes that really fit in well in our subspecialty. We started with the AnchorSure, which, as Catherine described, is a very excellent approach for sacrospinous fixation. And based on some of the data she shared with us, really seems to have a minimal pain profile. We then heard from Dr. Jarnigan about the needleless single incision sling, which is really a simple placement into the obturator internus muscle. And it was nice to see some of that 522 data that shows that the outcomes are similar to that obtained with ATOT. Finally, we heard about the Remix adjustable sling, which has some very unique characteristics such that it can be adjusted either tighter or looser a while after the procedure, which is certainly a nice option if necessary. And this is clearly a good option for those who have failed a prior sling of some sort.